Hi, I'm George Broderick, Medical Director of Cardiology at Good Samaritan Hospital and Dayton Heart and Vascular Hospital at Good Sam. I'm here to describe to you the cardiac catheterization procedure via radial access or radial artery heart catheterization that we're doing more and more at Good Samaritan Hospital. Currently, the procedure, cardiac catheterizations via radial access, in the United States is done about 3 to 4% of the time. At Good Samaritan, at this point, we're over 30% of the time performing radial artery catheterization, and some of our operators are performing them up to 80 to 90% of the time. The main benefit of radial artery catheterization is lower complication rates and patient satisfaction. Several large trials have been performed. The most recent trial, called the RIVAL trial, which was presented at the most recent Heart Association meetings, with over 7,000 patients randomized to either femoral versus radial artery access. That trial showed that overall there was no change in mortality or death from myocardial infarction via the femoral versus radial access approach, but there was a marked drop in bleeding complications with radial access compared to femoral access, marked drop in transfusion need, marked increase in patient satisfaction, and also in the subset of patients with ST elevation myocardial infarctions, there was an improvement in cardiovascular mortality and improvement in total mortality with patients who underwent radial access. This was a very important pivotal trial using over 7,000 patients, showing the ease and convenience of radial access approach to cardiac catheterization. Currently, in high volume centers, such as Good Samaritan Hospital, with radial access catheterization being performed frequently, this really helps our patients. The technique is difficult to learn, but experienced catheterization operators can learn relatively quickly. The patients are prepped initially with the Allen's test to make sure there's dual radial and ulnar blood supply to the wrist, and once that is established, a small catheter is inserted, usually a 5 French catheter or 6 French catheters can be inserted into the radial artery using a small angiocath and wire technique. Through the sheath that is left in the radial artery, all the catheterization procedures can be performed, such as cardiac diagnostic catheterization, evaluation of aortic and mitral valve disease, and coronary angiography. Through there as well, simple and even more complex coronary interventional procedures, multivessel coronary stenting, and aspiration thrombectomy and other procedures, intravascular ultrasound, and other procedures that we do in the catheterization laboratory through the femoral access can also be done via the radial access. At the termination of the procedure, the radial sheath is removed, a small compression device is placed on the wrist, and the patient is taken out of the room. The compression device is removed in 1 to 2 hours, even on significant blood thinners, and the patient's bleeding risk is markedly dropped and their convenience is increased. So we have found, as others nationally, that this is an excellent technique for patients to use that improves outcomes, improves patient compliance and satisfaction, and lowers bleeding complications.